Yes, I mean, why we decided to create a digital human in the first place, especially in the time of COVID, in the time of war, when we are all turning to technology and we all have less mobility and less opportunity to go out or commute, maybe even sometimes from city to have an interaction with a real life social worker. We thought that having an IT solution for this is a good idea. And in this regard, we were thinking chatbots, AI, and then somehow at some point a digital human idea came to mind. And we thought that actually having a digital human behind just a simple chat, who everyone is using nowadays, would bring more humanity, more human-like interaction into the scene. Basically, we have real human social workers in all of our programs. And in Ukraine, case managers, they have a pretty unique experience, and the results that they are actually producing are really good. And there are a lot of social workers, but they have a lot of work. And there are a lot of people who still aren't in the system, but who need to be paid attention to. And why it's not a doctor? Because a doctor has a set of functions and skills that maybe could be replaced by virtual creatures at some point, but necessarily, like in our area, you do require to take physical tests, not always, but at some stage to confirm the diagnosis. So the social worker is always like the first step, the access point. Oftentimes in our programs, all of those people who I've named, like social workers, outreach workers, case managers, they are peers. So peer is somebody who has gone through the same experience that you are going through. So in our case, since the epidemic of HIV in the region and in Ukraine is concentrated in a particular group or set of groups of people, it is oftentimes representatives of these groups of people who actually either are HIV positive themselves and going through the same things, or just avoided contracting HIV and can share the story behind the importance of testing and prevention. And really, our clients are happy with this approach. They create an environment of trust, and you really feel comfortable talking to someone like that, as opposed to somebody more professional who you might feel harder to approach. So we decided that if you draw a parallel, a digital social worker should also be somebody resembling someone from the communities. And that's where the idea basically.
Okay, excellent. That's perfect. Very good.